In this video, I'm going to help you understand how health insurance works in the Netherlands. I've been in the Netherlands for 3 years now, and as a foreigner relocating to this country, some concepts were really difficult for me to understand at first. Concepts like Eigen Risico, average contracted rate, basispakket or basisverzekering, and willende verzekering, and many others. But after learning about these things the last couple of years and even breaking my finger, you probably see this finger here a bit messed up. This is a picture of what it looked like before. So I broke my finger, and all through last year I needed treatment, had a lot of bills, and my health insurance came to save me of those bills. So from this experience, I can help you understand how health insurance works over here. In this video, I'll be covering the basisverzekering, average contracted rate, deductibles, and willende verzekering, with choosing an insurance provider or policy, changing your insurance provider or policy, how your insurance kicks in, if it's a direct bill or you pay and then you are reimbursed. And at the end of this video, I'll also tell you about what my insurance looked like in 2024 and what it looks like for 2025. Now in this video, I'm going to mention different insurance companies, but I am not endorsing any of these companies. I use ESR, but I am not endorsing any of this company. Whatever insurance company you choose is up to you and what matters to you. My hope at the end of this video is that you would know enough to be able to make better decisions with the health insurance company you go for or the kind of policies that you arrange with your insurer. Well, that's a lot of intro. Now let's get into the video. In the Netherlands, everyone who works or lives here is required to have health insurance. And when you relocate from a different country to the Netherlands, you have to get health insurance within 4 months. And what is even so interesting is that if you get your insurance on the 3rd month, you are still going to pay for the first 3 months before you pay for the remaining months where you live in the Netherlands. So the basic idea of this health insurance is that you pay a monthly premium, or let me just call it a monthly fee. You pay this to an insurance company, and then when you run into certain healthcare bills, these companies can step in to pay for you. Now this could be 100%, it could be a certain percentage, or it could be after you have paid a certain amount already. Now some companies allow you to pay monthly, some would even allow you to pay quarterly or maybe half a year or even pay yearly. Now this probably sounds straightforward or simple. You pay a monthly fee, you run into a healthcare bill, your health insurer steps in. It's not always as simple as that. It can be confusing, and that's what I hope to help you understand in this video based on my experience. So let's start from the basisverzekering. This is the basic health insurance, and the government determines which medical care is covered by the basic insurance, and the cost covered in this basic insurance is like basic medical care, then there's hospital treatment, then there's medical prescriptions at the pharmacy, dental care up to the age of 18, maternity care, limited therapies, and these are the basics that are covered in any health insurance companies that you go for. For example, if you look at Kraus, there is the Ziezo basic insurance policy. You can see what is insured here. There is the GP, medicines, physiotherapy for insured persons up to the age of 18, going to the hospital. And if you also look at the basic insurance for ASR, the basic insurance reimburses general practitioner care, your GP, hospital care, medicine, obstetric care, and maternity care. So the government determines what is reimbursed in the basic health insurance, but these companies can still be different in their offerings, that is after these basics. And this is where you get to understand why the basic insurance is priced differently for these different companies. As of 2025, ASR lowest insurance is 147.5 euros, Kraus is 149.5 euros, FBTO is 145.95 euros, ONVZ is 156.10 euros, and the Friesland is 148.95 euros. So why are the lowest insurance not all priced the same? Well, these different companies work differently. They have their different offerings and different services. For example, ASR lowest insurance at 147.5 euros has 65% reimbursement for healthcare providers without a contract. But then if you look at the basic budget, which is the lowest insurance for Kraus, you receive 75% reimbursement of the average contracted rate at care providers without a contract. I'll explain what average contracted rate means later. These differences is what usually influences the price, but there are more differences. For example, ONVZ will say something like 20 euros discount per month with an increased excess. Now I'm going to explain what excess means later on. Just basically what we see from this screenshot is that if you pay an excess of 385 euros, you don't get the discount, you pay 156 euros per month. But if you pay an excess of 885 euros, you get a discount of 20 euros, and then you pay just just 136 euros per month. And when you look at ASR will only give you 10 euros discount if you pay an excess of 885 euros. So these different offerings like the reimbursement levels influences the price. And then there are also things like extra services, different conditions provided at companies, or maybe it's just even competition to attract more customers. So what we see from these insurance companies is that they usually say things like 100% reimbursement if it's a company they have a contract with, and maybe 65% or 75% if it's a company they don't have a contract with. How then do you know if an insurance company has a contract with a particular company? Well, on their website, you can search for these things. For example, ASR has this Zorgzauke, which allows you to search for healthcare. I'm just going to translate this to English. So we're going to search for care. And for my physiotherapy last year, there was a particular company that I went to. So I can come to the name of healthcare provider. The postal code is 1083GN. And then this was a hand and wrists rehabilitation, Amsterdam. And then I can search. Okay, what I see here now is that in 2024, they had a contract with this company. So this way, I know that as I'm going for that physiotherapy who got to treat my hand after this accident, I knew I was going to get 100% reimbursement back. We can also search on Silverenkraus. I also have to be honest though that searching on these things sometimes is difficult. I think it's because of the Dutch and then I have to translate it to English. But let's say I try to search for hand and wrist rehabilitation. Yeah, let's search. This doesn't exist. Physiotherapy. The name of the institution is hand and wrists rehabilitation. Postal code 1083GN. Let's search. No results. I'm not sure if I'm even typing this correctly in the first place, but let's say for this institution I search for OLVG West because I also got some treatments from them last year. OLVG West location in Amsterdam, and let's say I have the basic budgets. I could see here that they have a contract with OLVG West, and I was at OLVG West last year. So if my health insurer is Silverenkraus, I now know that any treatment I get there, well, not any treatment that falls under my health insurance agreement with the company will be 100% reimbursed. This way, you can make decisions about what healthcare providers you want to go to after discovering if they have a contract or not. But let's come back to average contracted rate. So from these health insurance companies, we see something like 100% reimbursement for a company with a contract. Then you see something like 65% reimbursement at the average contracted rate for a company without a contract. So what is that average contracted rate? Now, as we see on ASR, average contracted rate is the amount we pay on average for treatment to healthcare providers with whom we have a contract. Now, from my research, what I understand about this is, let's say ASR has a contract with a company called Company XYZ or Dillion's big health company, something like that. Now at my company, physiotherapy is 50 euros. Now there are two other companies, company B 100 euros and company C 200 euros. Let's just say something like that. And then ASR has a contract with my company and these two other companies. So for physiotherapy, there is 50, 100 and 200. The average contracted rate is now going to be 50 plus 100 plus 200, which is 350, and 350 divided by 3, 116 euros. So this means that if a customer goes for physiotherapy with a company that ASR doesn't have a contract with, even if that customer gets to spend, 500 euros per physiotherapy session, it doesn't mean that ASR is going to give that customer 65% of the 500 euros. No, ASR is going to give that customer 65 euros of the 116 euros, which is the average from the rate that ASR has with these three companies. So from all of these, you can see that it's easier to just go for a company that has a contract with your health insurer, because that way you don't have these complicated calculations where even though you are spending much more, ASR is only reimbursing from their own average. So previously we talked about deductibles or excesses. In Dutch, it is called Eigen Risico, which is basically own risk. The basic idea of this is how much risk are you willing to take before your health insurer steps in. So when you're trying to get your basic insurance, these insurance companies will tell you how much deductible are you willing to go for. The lowest, I think, as said by the government, is 385 euros, and the highest is 885 euros. Now, if you go for 385 euros, this means that when you get healthcare treatment all through a year, there is a 385 euros own risk that you have to pay for first before your health insurer steps in. Now, this is restarted every new year. So if in this year you only spend 100 euros, by next year you start from zero again, and until you get to 385 euros before the health insurer steps in. And then if your Eigen Risico is 885 euros, then that means you have to pay up to 885 euros in a year before your health insurer steps in. Now, this does not mean you always have to pay the deductible for every treatment. No, for your supplementary insurance, you don't have to. We'll talk about that later in this video. For your general practitioner assistance, you don't have to pay for your deductible. I think that one is free for any health insurer. But for some other treatments, like for example, when I broke my finger and I needed treatment, before my health insurer stepped in, I had to first pay 385 euros. And actually, let me show you what that looked like. Here on my ASR dashboard, you can see my healthcare cost for 2024. Let me first go to 2023. So I had a treatment for 2023 that cost me like over 600 euros or so. I had to first pay an own risk of 385 euros before the health insurer stepped in to pay 236 euros. And we'll go to 2024. The health insurance stepped in to pay 772 euros after I had already paid 385 euros, which means if my own risk was 885 euros, then the health insurer would have paid probably like 200 and something euros or so. Now let me look for some of those treatments from here. I have to be careful what detail I show you. So this was the treatment for 2023. I had a bill of 597 euros. I had to pay my own risk of 385 euros before I was reimbursed 212 euros. So this was my first treatment for 2024, and there was an own risk of 61.65 euros. I wasn't reimbursed anything. That came from my pocket. I also went for GP assistance, and GP assistance is usually free, so I was reimbursed that. That did not have to come from my own deductible. So I already paid 61.65 euros in 2024, right? Then at my physiotherapy place where I got some treatments for my finger, I had a bill of 873 euros, and as you can see, I had to pay an own risk of 323 euros, which is the remainder from the 61.65 euros I already paid to amount to 385. Then after paying this, the health insurer kicked in by paying the 549 euros. And that was kind of like the last treatment that I had for the year that was said to my health insurer. If not, every other thing would have just been from the health insurer since I had already used up all my deductible. So that deductible is a measure of how much risk you are willing to take. And usually these health insurers would give you a discount when you take a higher deductible. So just like we saw earlier, ONVZ was going to give a 20 euros discount if you went for a deductible of 885 euros. So instead of paying 156 euros per month, you only pay 136 euros per month. So the idea here is the higher the risk you are willing to take, the more discount the company is going to give you. Let's say, for example, I went with ONVZ, I took the 885 deductible. So that's 20 euros that I get to save per month, right? In a year, 20 times 12, I get to save 240 euros. But that is if I don't get sick or have accidents or need treatment. Because if I do, just like here where I had a 873 euros expense, if my deductible was 885, this means all of this bill is going to come from my own pocket. So if I don't have any accident or have any need to go to the hospital, I get to save. But if I have something like this, I am paying for everything. But because my deductible was 385, then my health insurer could step in with like 500 euros. And if you do a simple calculation here, okay, so I would have saved 200 euros, but if such a bill came, then 800 minus 200, my expense will be 600 euros. So from the comparison here, I only get to pay 300 euros without having any discount, but then somebody else had a discount of 200 euros, but still got to pay 800 euros. 800 minus 200, 600. I only got to pay 300 euros. You got to pay 600 euros when an health issue came up. Because I have a friend who said that, yeah, I have a higher deductible because I don't get sick easily. Well, guess what? I don't break my finger easily. It happened when I least expect. So again, it really depends on the risk you're willing to take. If the discount sounds really enticing to you, go for it. It's a risk because you never know what's going to happen through the year. I never know what's going to happen through this year. I hope I don't have any other accidents, but at least if I do, I am taking the less risk, which is the lower deductible. But if you go for the higher deductible and you do, then that's your problem. Now let's go to the aanvullende verzekering, which is the additional insurance or the supplementary insurance. Now this is insurance for things that are not included in your basics. So things like maybe dental insurance, physiotherapy, glasses, or some special treatments. And one thing you should know is that this supplementary insurance, they don't touch your deductible. Your health insurer just pays for it. Let me show you an example. So last year I had a supplementary insurance for physiotherapy, and whenever I went for physiotherapy, I didn't have to pay. Here's an example. So I had a supplementary insurance that allowed me to have 9 physiotherapy sessions. This is one of them here, and you can see that it wasn't taken from my own risk, but it was reimbursed from the supplementary insurance, 35.45. Down here, you can see individual session of regular physiotherapy. So this supplementary insurance, they don't touch your deductible. Your health insurer just pays for it. Now, different insurance companies offer different supplementary insurances, some cheaper, some more expensive, some with more physiotherapy, some with more dental visits, and so on. For example, ASR offers Care Basic, where you have 3 physiotherapy treatments, contraception, replacement care, yada yada yada. Care Conscious, where you have 6 physiotherapy treatments. Care Good, which is the one I went for last year, which was actually a mistake, where I paid 13.5 euros and I got 9 physiotherapy treatments. Now the reason why I say this was a mistake is because as part of my basic insurance or with my additional module, if I need physiotherapy after an accident, I am insured for that. But I didn't really know, or I kind of knew, but then I wasn't getting the validation I wanted from the company. And then I was going into the new year, 2023 to 2024. The accident was in 2023. And then I was kind of scared, like, I'm not sure if my health insurer is going to pay for this. And so I went for this Care Good. But eventually my health insurer paid for it. And then there is also the dental insurance, dental awareness, dental good, tooth better. You can add these things, and the more you add these things, the more your monthly premium increases. Silver & Kraus, on the other hand, they have a basic plus module where you get emergency care abroad, dental cost after an accident up until 10,000 euros. They also offer dental supplementary insurance, tooth-based, tooth and tooth. You can go online, check out these health insurance and see what the supplementary insurance are. This is not required. The basic insurance is what you have to have, but the supplementary insurance now comes down to you. What is important to you? What do you care about? What do you not care about? So now let's move on to choosing a healthcare provider or choosing an insurance policy. I've mentioned different providers in this video, but which one is the best? Now, I don't think there is a best one. I don't even think ASR that I use is the best. Now, all of this comes down to what matters to you. Are you looking for a health insurer that offers the highest discount with the highest deductible? Like ONVZ could be your choice. Are you looking for a health insurer that has the highest reimbursement for companies without a contract? Now, all of this depends on you. Which one has contract with more companies, or which one has contract with the companies you care about? Because it's possible that you have your own best physiotherapist, your own best blood, whatever, your own best maternity care, and then you can check for the insurer that has these companies. But then there are also some websites that you can use, like zorgkeizer.nl. Please translate everything to English. So here I can put my date of birth. Let's just say I was born on the 12th of February 2000. I'm a man, 1, 2, 3, 4, A, B. I don't want to insure family members. Now I can choose the things that matter to me. I'm just going to put 385. Maybe physiotherapy matters to me. I would like to get like at least 6. Maybe dentists, like up to 100 euros. Dental accident coverage of up to 2,000 euros. Foreign coverage if I'm traveling a lot and I want to be insured even when I am outside the country. Yeah, I think all of that is fine. Then I can view the results, and now I get to see the healthcare deals that match the things that are important to me. So there is this one, 162 euros per month. There's ESR where I get to pay 174 euros per month. There's FBTO where I get to pay 165 euros per month. From these, you can make an obvious choice to say, okay, 162 euros is the cheapest, but you can still go further to visit this company and check if they have maybe the healthcare providers that you are interested in. Or you can also use this handy feature where you say compare, and now you can compare these 3 companies, and here you can see this is the own risk, the reimbursement for non-contracted care. ASR will give you 100%, FBTO will give you 65%. So maybe you want 100% so that you don't have to choose one company or the other. You can just go for any company you want, contract or no contract, to get 100%. You can basically compare and then make your decision from here. And there is also Zugweise.nl. It works the same way. 12 February 2000. I get a couple of options here. I want to compare FBTO, ASR, and the Friesland. But with this website, you can make your choice, see what health insurer goes with what matters to you, and make your choice from there. One thing to note with choosing a healthcare provider is that you can't really make a terrible decisions, because at the base level, all of these insurance companies, they are offering the same thing. And then when we talk about healthcare policy, so you already have your health insurer in mind. Let's say it's ASR. I'm not endorsing ASR. You can now choose what policy works for you, and then you can calculate your premium. So from the previous page on this ASR, I can calculate my premium. 12 of February 2000. I want my insurance to start, I don't know, on the 1st of February 2025. And we go to next. So here now we can choose a policy. There is a conscious choice, the wide choice, and the own choice. With the conscious choice, I have 65 reimbursement without contract, 85% for the wide choice without contract, then 100% for the reimbursement for own choice. And then you can scroll further. Let's just say I choose the conscious choice. You can go further, choose your deductible. If you have a deductible of 585, you have 4 euros discount. So instead of paying 147, down here you see you pay 143. I don't want any discount. I keep going. For your additional insurance, you can choose which one matters to you here. I don't care about all of this, to be honest. I don't care about the dental insurance. My teeth are very good. I can choose this additional modules. Here you can choose accident cover, physio, and dental. And I chose that. No, I didn't choose this one actually. I chose this one because this one also has accident cover for abroad. So 100% reimbursement for emergency medical care abroad. This was the one I chose for this year. I'll show you that later. And if you're somebody who cares about glasses and lenses, you can choose this one. So I go with that one. Then I can go to the overview page. And now this is how much I'm going to be paying per month. This is how you choose your policy. These health insurers have different offerings, and the more you want, the more you pay for, but then that's up to you. Do you actually want more or not? Now, canceling your health insurance, let's say you want to change your health insurance. Usually you can only change your health insurance at the beginning of the year, before 1st of January. Every year between mid-November and 31st December, you can switch health insurers. But then you can't always change your health insurer just mid-year. There are specific situations where you can do that. Maybe when you turn 18, or if your policy conditions have changed in the meantime. If you get divorced, if you're not currently insured, depending on when you arrive in the Netherlands, then you can change your insurance, or you can find an insurer mid-year. If you leave the Netherlands to reside in another country, then you can cancel your previous health insurance. But apart from these few cases, you have to wait till the next year before you can change your insurer provider. But when it comes to changing the policy, so you're not changing your provider, you're still staying with Silvan & Kraus or the Friesland, I think some of these companies would allow you to change the policy mid-year. Now, this is where you have to call the company and ask them, can I change this or not? I don't think there's like a standard rule. It really depends on the company. If they want you to add a supplementary insurance mid-year, or if they don't allow you to do that now, that's something you can call and check in, like, is it possible to do this? But usually these are decisions you have to make before the new year or before the 1st of February. So let's talk about how your insurance kicks in. You already have a healthcare provider, you have an insurance policy, but how does it work? Who handles the bills, and when do you get reimbursed? Now, in the Dutch healthcare system, I think this really depends on either the kind of treatment you're getting or the arrangement that you have with your health insurer provider. Now, as we saw earlier, the company I got the treatment for my finger, they had a contract in 2024 with my health insurer. So every bill that I got from there went directly, this is what you call direct billing. It went directly to my health insurer. My health insurer paid for it, and my health insurer also asked me, so where is your own deductible? Pay for it too. And I sent the money to my health insurer. But If, for example, I went to a company without a contract with my health insurer, in that case, the company might have to send the bill to me. I pay for the bill, then I can now send, which is called self-claiming. I can now send a claim to my health insurer that, hey, I know you didn't have a contract with this company, but you should reimburse me 65% as our agreement states. Depends on the type of care, the arrangement you have with your insurer provider, or just different circumstances. But as always, you can go to your health insurer, call them, ask them, how does this work? When do I get reimbursed? Do I get reimbursed for something like this or not? Do I send a claim? Have you already gotten the bill? And things like that. Well, that's everything I have here, but I just want to quickly show you what my health insurance looked like for 2024 and 2025. Okay, this was my health insurance for 2024. I was paying 153 euros per month. Because I went for the good choice, paying 141 euros. My deductible was 385, so I didn't have any discount. I was paying a supplementary insurance of Care Good of 12 euros. This was where I got the 9 physiotherapy, which I didn't have to because in my additional module, I already had accident cover, physio, and dental. So since I had this, the physiotherapy I needed after my accident was already insured, but I wasn't sure. I was already insured, but I wasn't sure. And so I went for this Care Good and then ended up paying 12 times 12, 150 euros for the whole of last year. So in 2025, I still went for the good choice, which is now 153 euros. Wait, this is actually funny because on the website, they say the good choice is 147 euros, but I'm paying 153 euros. How does that even work? 147 euros per month for the conscious choice, or did I choose the wide choice and I didn't know? I feel like I've made another mistake for this year again. This is conscious choice. And here I have good choice. Please, what exactly is good choice? I see. I think this is because I wasn't using ASR from the beginning. So it was previously Ditzo, and then from Ditzo, I came to ASR. I don't know if ASR bought Ditzo or they just changed their name. Anyways, I'll try to make sense of all of this at the end of this video. But I also went for additional module of abroad, like I mentioned earlier, where I pay 1.75 euros extra. So this way, if I get an accident abroad, Europe or wherever, or I need physio after an accident or dental, maybe I lose my teeth or something, I am insured for that. So this is everything I understand about health insurance in the Netherlands. If you have any questions, let me know in the comments. I probably missed a few things here and there, and if I need to make a part 2, I will make a part 2 based on the questions that I get. But I hope that with this, you can now make better decisions for next year. Have a great rest of your year. See you in my next video. Oh, and of course, please like this video and share it for whoever may find it helpful, and subscribe for more Netherlands related videos like this. That was a lot of talking. Bye-bye. Okay, so while I was editing this video, I finally realized why I'm paying 153 euros. ASR has the normal ASR on the right, and they have ASR Ik Self on the left. And this comes from, just like I pointed out previously, Ditzo. So I found this on Zorgkiezer. Jesus, the pronunciation. Ik Self is a health insurance offered by ASR, blah, 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 blah. Ik Self was previously known as health insurer Ditzo. So I used to have an insurance with Ditzo. I think Ditzo was previously under ASR, but then it rebranded more to fit ASR, and that's why there is now ASR Ik Self, which is this. So with this Ik Self on the left, this is where I have the good choice. This is where I was thinking, where did good choice come from? So this is where I have the good choice, and I have this 153 euros per month, and the normal ASR we have conscious choice. And what I see here is that good choice for Ik Self is basically the wide choice on the normal ASR, because it's also 153 euros. So what I'm trying to do now is to call ASR and tell them that I don't want good choice, I want conscious choice. And hopefully I'm able to change that, because I'll get to save like 72 euros, 6 euros every month through this year. So if that's something that I can really change, I'll be happy about that. I'll let you know in the comments if I'm able to change that. Just wanted to clear out the confusion that I'm paying 153 because I am doing good choice on Ik Self. But if you go for the normal ASR, which I should have done before the new year, then you only get to pay 147.5 euros. Okay, so once again, bye-bye. All right.